Now, more women are dying in Ghana from pregnancy-related hypertension known as preeclampsia than what occurred 10 years ago. The condition now accounts for 18% of maternal death in the country, up from 9% before the last decade. Now, anti-preeclampsia campaigners want the government to invest in monitoring to reduce the occurrence. Love FM's Kwesi Deborah has more in this report.
Though progressive interventions are targeted at early diagnosis and prompt management, lack of definitive cure makes it life-threatening. Dr. Kwame Edubonsafo, a consultant obstetrician and gynecologist at the University of Ghana School of Medicine and Dentistry, who has been involved in clinical research on hypertensive disorders in pregnancy, is worried Ghana still continues to record high numbers.
Preeclampsia is one of the main hypertensive disorders in pregnancy, and it is associated with significant maternal mortality and morbidity. So if you look at it in Ghana, for instance, about 10 years ago, preeclampsia and hypertensive disorders actually caused about 9% of maternal deaths. And this figure has actually doubled over the 10-year period, and now it accounts for about 18% of maternal deaths. And for me, this is worrying, because if you compare to other countries, like for instance, the United Kingdom, for the recent release of report, it shows that they have actually reduced the maternal mortality due to preeclampsia and hypertensive deaths.
A consultant obstetrician and gynecologist at the Konfonochi Teaching Hospital, Professor Kwabena Mchidanso, identifies lack of incentives in low-income countries as a major hurdle in managing the disease.
And in most of the facilities, the hospitals, we do not have the means to manage babies who are born preterm. Then also, we do not have the means to monitor the woman in terms of blood pressure equipment. You know, these days we need to use the digital type of blood pressure equipment, but these ones are not readily available at the the rural areas where many of the conditions occur.
Action on Preeclampsia Ghana is a sole preeclampsia working advocacy group in Ghana. It is actively in research and monitoring of women at risk for professional assistance. It also seeks to create awareness to reduce maternal mortality associated with preeclampsia and eclampsia. Executive Director Kiowa Kwelabi Ofuswapia emphasizes increased government support is crucial for survival of patients.
Is that we need to invest in the area of monitoring. We need to get those machines that, when somebody is admitted into a facility for being severe preeclampsia or preeclampsia, we know that with this patient, we have to put this special monitoring system around that person. Because I think that's one of the key ways of, saving the lives of the baby and the mothers. Because as I said, it is a progressive disease and not a regressive one.
The organization has brought together experts, students and policymakers from Ghana and other African countries with proven track record on preeclampsia management and research in the maiden preeclampsia scientific meeting in Kumasi. Is under the theme, improving management of preeclampsia through awareness, research and innovation. Director of Family Health Division of Ghana Health Service, Dr. Patrick Abuaje, says measures are in place for early detection and treatment. His speech, which was read by Dr. Emmanuel Srofenyo, indicated midwives are issued with new protocols to effectively cater for preeclampsia. Reporter for JoyNews, Kwesi Deborah.